In this podcast episode, Andrew Huberman interviews Dr. Marc Berman, a professor of psychology at the University of Chicago and director of the Environmental Neuroscience Laboratory. Their conversation delves deeply into the science behind how our physical surroundings, especially natural environments, influence brain function, mental health, cognitive performance, and overall well-being. Dr. Berman's research offers compelling evidence and practical strategies for harnessing nature's restorative power to enhance focus, reduce stress, and improve health outcomes. The discussion begins with the concept of directed attention, a cognitive resource that allows individuals to focus deliberately on tasks despite distractions. Dr. Berman explains that directed attention is a finite resource, susceptible to fatigue after prolonged use. This depletion manifests as difficulty concentrating, reduced impulse control, and diminished goal achievement. Unlike involuntary attention, which is automatically captured by salient stimuli and is less prone to fatigue, directed attention requires conscious effort and is easily exhausted in modern environments filled with constant information bombardment. Attention restoration theory, ART, pioneered by Steve Kaplan, provides a framework for understanding how different environments either deplete or restore directed attention. According to ART, environments that softly capture involuntary attention without demanding directed attention, such as natural settings, allow the brain to replenish its attentional capacity. In contrast, urban environments with harshly fascinating stimuli, like billboards and traffic, continuously tax directed attention, preventing restoration. This theory underpins much of Dr. Berman's research and practical recommendations for managing cognitive fatigue. While the psychological experience of attentional fatigue is well documented, the precise neurological mechanisms remain elusive. Dr. Berman and Dr. Huberman speculate on the involvement of brain regions such as the frontal cortex, which governs directed attention, and parietal or occipital areas that mediate involuntary attention. They also consider the role of neuromodulators like dopamine and norepinephrine, which regulate arousal and focus, though definitive answers are still forthcoming. Interestingly, the brain's metabolic rate remains relatively constant regardless of cognitive load, posing a puzzle as to why mental fatigue occurs. One hypothesis is that attentional fatigue may not be purely metabolic, but also related to the brain's processing efficiency and the quality of sensory input. For example, restricting visual input to a narrow field or reducing distractions can help preserve directed attention, a strategy some creatives have historically employed to enhance focus. This interplay between sensory processing and cognitive control highlights the complexity of attentional fatigue. Dr. Berman shares pioneering experimental work demonstrating that walking in nature significantly improves working memory and directed attention compared to walking in urban environments. In a controlled study, participants completed challenging cognitive tasks before and after 50-minute walks, either in a natural arboretum or a busy city street. The results showed a remarkable 20% improvement in cognitive performance following the nature walk, independent of mood changes or weather conditions. This objective evidence moves beyond subjective reports of feeling refreshed after nature exposure, confirming that natural environments have measurable benefits on brain function. The study's rigorous design, including GPS tracking and control for distractions, strengthens the conclusion that nature uniquely restores cognitive resources. These findings have profound implications for daily routines, suggesting that even brief, intentional interactions with nature can boost mental performance. The restorative power of nature is attributed to several key features. Natural settings typically require less directed attention because they lack the constant demands of urban environments, such as navigating traffic or processing advertisements. Instead, nature provides soft fascination, a type of involuntary attention that gently engages the senses without overwhelming cognitive resources. Examples include the sound of flowing water, the visual complexity of fractal patterns in trees, and the gentle rustling of leaves. Fractal geometry, a hallmark of natural forms, plays a crucial role in this soft fascination. Fractals are self-similar patterns repeated across different spatial scales, found in tree branches, coastlines, and mountain ranges. These patterns are easier for the brain to process because they contain redundancy and predictability, allowing for efficient sensory encoding. In contrast, urban environments with sharp angles and irregular structures demand more cognitive effort, contributing to attentional fatigue. Recognizing that not everyone has easy access to outdoor natural environments, Dr. Berman's research also explores the effects of simulated nature exposure. Viewing slideshows of nature scenes or listening to nature sounds in a laboratory setting produces measurable improvements in working memory and attention, though these effects are less pronounced than actual nature walks. This suggests that even partial or indirect exposure to natural stimuli can confer cognitive benefits. The format of these simulations typically involves standard computer screens and headphones rather than immersive panoramic displays, indicating that the brain responds positively to relatively simple representations of nature. However, the multisensory richness of real nature, combining visual, auditory, tactile, and olfactory inputs, likely amplifies its restorative effects. These findings encourage incorporating natural elements into indoor spaces to support cognitive health. Dr. Berman touches on intriguing observations regarding how natural environments influence subjective time perception and impulsivity. People tend to experience a slowing of time in nature, reflected in increased reflection on past experiences and reduced impulsivity compared to urban settings. Although direct experimental evidence on time perception is limited, related studies show that urban dwellers walk faster and experience a more hurried pace of life. Moreover, exposure to nature correlates with reductions in aggressive behavior and impulsivity, potentially mediated by improved attentional control. Large-scale data analyses reveal that neighborhoods with higher park visitation rates exhibit lower crime levels, suggesting that nature's calming influence extends to social behavior. These findings underscore nature's role not only in individual cognition, but also in community well-being. Beyond cognitive and psychological benefits, nature exposure has profound effects on physical health. Dr. Berman highlights landmark studies such as Roger Ulrich's hospital room experiment, where patients with views of trees recovered faster and required less pain medication than those facing brick walls. This suggests that even passive exposure to natural scenes can facilitate healing. Further epidemiological research in Toronto links increased tree canopy in neighborhoods to better self-reported health and lower incidence of stroke, diabetes, and heart disease. These associations persist after controlling for socioeconomic factors, indicating a robust relationship between urban greenery and physical health. While mechanisms may include improved air quality, increased physical activity, and stress reduction, the evidence supports integrating nature into urban planning as a public health strategy. For individuals lacking access to outdoor green spaces, indoor plants and biophilic design offer alternative pathways to harness nature's benefits. Studies show that indoor greenery can improve attention and mood, and hospitals incorporating plants report enhanced patient well-being. Even artificial plants and nature sounds may provide some restorative effects, though real plants likely offer greater benefits. Biophilic design extends these principles to architecture by incorporating natural patterns, curved edges, and organic forms into built environments. Dr. Berman's research demonstrates that people prefer architectural features that mimic natural fractal patterns and curved lines, associating them with feelings of comfort and spirituality. Such design elements may foster psychological restoration and enhance cognitive function, suggesting that integrating nature-inspired aesthetics into homes and workplaces can improve mental health. The conversation critically examines the cognitive toll of modern digital environments, particularly social media and texting. Unlike nature's softly fascinating stimuli, social media is described as harshly fascinating, aggressively capturing directed attention and fragmenting cognitive resources. The rapid switching between diverse content types and conversations resembles cognitive chaos, undermining sustained focus and contributing to attentional depletion. Research on multimedia multitasking confirms that frequent switching between digital tasks degrades attention rather than training it. The addictive design of social media platforms exploits dopamine-driven reward circuits, encouraging prolonged engagement at the expense of cognitive restoration. Dr. Berman and Dr. Huberman emphasize the importance of mindful technology use and deliberate breaks in nature to counteract these effects and preserve attentional capacity. Drawing on the research, Dr. Berman offers actionable advice for individuals seeking to optimize their cognitive function and mental health. When experiencing difficulty concentrating, rather than forcing through fatigue, taking a break in nature, even as brief as 20 minutes, can restore directed attention. Ideally, these breaks should be solitary and phone-free to maximize engagement with the environment's softly fascinating stimuli. For those without easy access to natural settings, simulated nature through images, sounds, or indoor plants can provide partial benefits. Incorporating nature breaks into daily routines, workplaces, and schools could revolutionize productivity and well-being. Dr. Berman envisions a future where nature exposure is regarded as a necessity rather than an amenity, integrated into urban design, education, and healthcare. The episode concludes with reflections on the societal implications of Dr. Berman's findings. The modern built environment and lifestyle often neglect the human need for restorative nature exposure, contributing to widespread attentional fatigue, mental health challenges, and physical illness. Reimagining cities with abundant green spaces, biophilic architecture, and nature-based interventions could enhance collective cognitive health and social harmony. Dr. Berman advocates for a nature revolution that elevates the importance of natural environments in public policy and personal habits. He also highlights the need for further research into the neural mechanisms underlying nature's effects and the development of scalable interventions.